Welcome to Zered Podcast. Today we are looking at human resource theories and how they shape workforce management in healthcare. Picture a district hospital in Kumasi, doctors saving lives, nurses rushing between wards, and support staff keeping things running. The people make it work, but managing them well is a key. We'll look into what health workforce management is, the theories behind it, and how I would apply them as a hospital administrator. This will be told through stories with clear notes for you to jot them down. Healthcare workforce management is about recruiting, training, and keeping a skilled team to deliver great care. It's different from a factory because it's about saving lives, not just meeting quotas. The World Health Organization groups health workers into five categories: health professionals like doctors and nurses, associate professionals like lab technicians, personal care workers like health aides, management and support staff like medical secretaries, and other service providers like ambulance drivers. Let's look at the difference between healthcare versus the industry. What makes hospital unique? Let's meet Dr. Amma, a doctor in a Kumasi hospital. Her job isn't like working in a factory. In healthcare, work is unpredictable. Emergencies pop up and decisions affect lives. Amma's team collaborates closely, focusing on patient care, not profit. The work is fast paced, often stressed with long hours and emotional strain. Unlike the structured shift in a factory, job satisfaction for AMA comes from helping patients, but burnout is a real risk. Factories focus on output and safety with less emotional weight. Let's look at the scope of health workforce management. Managing a hospital's workforce covers many areas. Imagine I'm the administrator of this commercial hospital. I'll focus on recruiting skilled staff like nurses, planning schedules, cover busy wards, and training workers on new equipment. I'd also manage performance, ensure fair pay, follow health regulations, keep staff motivated, and reduce turnover. These elements, recruiting, scheduling, training, performance, compensations, compliance, engagement, and retention are the backbone of workforce management. HR theories. Human resource theories guides how we manage people like Amma. Let's look at five key ones and how they apply to our hospital. These are like recipes for keeping the team strong and patients happy. Human capital theory. This theory says people's skills and knowledge are valuable, like money in the bank. Investing in training makes them better at their jobs. For Amma, I'd offer workshops on new surgical techniques. A 2024 study shows trained nurses in Ghana improve patient recovery rate by 15%. This keeps staff happy and reduces turnover. Human capital theory emphasizes investing in training to boost skills, improving patient care, and staff retention. Maslow's hierarchy of needs. Maslow says people have needs, from basics like food to higher goals like feeling fulfilled. In the hospital, I would ensure Amma's basic needs are met, safe working conditions, fair pay. Then I'd offer growth opportunities like leadership training to help her feel accomplished. This motivates her to stay and excel. Maslow's hierarchy of needs suggests meeting basic needs, safety, pay, and higher needs, growth, recognition to motivate healthcare staff. Herzberg's two factor theory. Herzberg splits job factors into two: hygiene factors like pay and conditions, which prevent unhappiness, and motivators like recognition, which make people love their jobs. For Amma, I'd ensure decent salary and clean wards to avoid frustration. Then I'd praise her for great work like saving a patient to boost her enthusiasm. Hesberg two-factor theory says improve pay and conditions to prevent dissatisfaction and use recognition to motivate the staff. Equity theory. This theory is about fairness. Amma wants her efforts, long hours, saving lives to match her rewards, like pay or promotions. If she sees a colleague get a raise for less work, she will feel cheated. I'd use transparent appraisals to ensure fair rewards, keeping her engaged. A 2024 Ghana Health study found fair pay cuts nurse turnover by 10%. Equity theory stresses fair rewards for effort, like transparent pay and appraisals, to keep healthcare workers satisfied. Social exchange theory. This says good relationships between staff and managers build loyalty. If I support Amma with flexible schedules or mental health resources, she'll feel valued and stay longer. Creating a supportive culture, like team meetings to share ideas. It fosters trust and commitment. Social exchange theory promotes supportive relationships between staff and managers to boost loyalty and retention. Applying these theories as a hospital administrator. If I'm running the Kumasi Hospital, here's how I'll use these theories. For human capital, I will set up monthly training on new teach, like diagnostic tools to improve care. For Maslow, I'll provide safe wards and career paths, like promoting Amat head nurse. Hertzberg's theory, it means fixing broken equipment and praising great work. Equity theory guides me to use clear appraisal systems, say reviewing MS patient outcomes fairly. For social exchange, I'd hold regular staff check-ins and offer counseling after tough cases, building trust. Apply theories by offering training, one capital, meeting needs, Maslow, improving conditions and recognition, Hesberg, ensuring fair rewards, equity, and building supportive relationships, social exchange. So let me go over again without adding the theories. Applying theories by offering training, meeting needs, improving conditions and recognition, ensuring fair rewards, and building supportive relationships. Let's move to workforce management strategies. To make this work, I'd use specific strategies. First, leadership. I'd adopt a transformational style, inspiring Ama's team to aim high, like reducing waiting times. Second, employee engagement. I'd offer mentorship and flexible shifts to keep staff happy. Third, retention. Benefits of staying in rural posts and mental health support can cut turnover. Fourth, diversity. Hiring staff from different backgrounds, ensuring we serve all patients well. Finally, succession planning. I train nurses like Amma for leadership roles to prepare for future needs. Strategies include transformational leadership, engagement, diversity, and succession plan. That's the story of human resource theories in healthcare. People like Dr. Amma are the heart of our hospitals, and theories like Maslow's or equity helps us manage them better. As an administrator, I'd use these to train, support, and keep a skilled team, ensuring great patient care. What's one way you would support hospital staff? Share your thoughts in the comment section. Thank you for listening to Zared Podcast. See you next time.